there really is no conventional treatment yet, which is really unfortunate, and so these patients just have nowhere to turn.
Searching for answers this morning, even as we learn more about the coronavirus, doctors are still stumped when it comes to COVID long hauler symptoms. As Nohalani Graf shows us, there's a new study right now in the Valley to find a better way to treat the brain fog, the muscle pain, those symptoms that linger seemingly, months after this. We hear from so many people, and this is their reality.
And we're going to hear from more and more, Nick, because the most recent study shows you have a 50-50 shot if you get COVID of getting those long-term side effects. And some doctors right now are prescribing multiple medications with no end in sight. So homeopathic specialists here in Tempe are trying to use plant and mineral-based medicines in the hopes of finding long-term natural solutions. Melanie Farkas is a mom of 3. Her youngest is still a baby, so she knows the scatterbrained, sleep-deprived way of life we endearingly call mommy brain. But after 2 bouts with COVID,
I feel like I'm just upside down.
She says her level of fatigue changed dramatically.
With the mom fatigue, if I'm able to get a good night's sleep, I feel refreshed and I feel regenerated. But with this, it's I can sleep 9 hours and I still wake up just so tired.
Add that to new feelings of anxiety.
Increased heart rate. I kind of am just constantly worrying where before I wasn't. Sometimes it kind of feels like your insides are trembling a little.
Stories and symptoms like Melanie's that Dr. Elizabeth Rice says she's hearing a lot more of.
See a lot of fatigue, a lot of brain fog, and from there's a constellation of symptoms that can arise.
With people focusing more on what they will or won't put into their bodies, she's investigating whether holistic, natural medicinal remedies are a viable treatment for long hauler symptoms.
There were no true side effects from this medicine. It's very safe and it's very gentle.
Launching a study at Southwest College of Naturopathic Medicine and Health Sciences in Tempe and crossing into 8 other states, she's already seeing success.
In the weeks that followed is that she needed to use her medication less for her joint pains.
About 6 patients now being tracked for 3 months. When the study wraps, hopefully the non-placebo patients will be able to get back to their pre-COVID selves.
To be able to, get things done in the morning, because I feel like my mornings is really when my kids need me the most.
And it is important to note that all of the doctors involved in this study are volunteering their time to help patients find relief. And Nick, they hope to publish their findings early this year.
Yeah, think of all the people that they could help with this, right? So many people who are just desperate for answers on, how to get some of these things back that so many of us take for granted. No, hey, great information there.